Today we're going to be mixing the alginate material. What you're going to need is your mixing bowl, your spatula, your alginate material, your measuring cylinder, your measuring scoop, your water, your impression tray, alcohol 2x2s, for PPE, you're going to want your safety glasses, a mask, and some gloves. And probably your lab coat so you don't get it all over you. When preparing to make an impression on a patient, you want to find the tray that works the best on that patient. So what you're going to do is you are going to have, you're going to have the patient sit there, and then you are going to use your mirror and look into the patient's mouth. And then you are going to try to fit the impression, the tray. So you're going to pull the cheek back and you're going to have it open up. You're going to pull the cheek back. And then you are going to pull the cheeks out. And looks like a pretty good fit. There isn't much material hanging over. And then you're just going to do the same for the maxillary. You're going to have them open, you're going to have them bite down. You still have room, it's still seated in the middle of the arch. And then you are ready to mix your material. For mandibular, the ratio for mixing the alginate is 2:2. So that would be, so your glass is going to have lines on it. So that's going to be about 2 right there. And then you're going to take your scoop and you are going to mix. And then you're going to take your mixing spatula, you're going to mix for about 30 to 45 seconds. And then halfway through, you're going to wipe off your spatula. And then what you are going to do is you would pour it into the tray. The mandibular goes first. Since mine's a little thicker, a little runny, I'm not going to be able to, but you pour it in there. Mandibular goes first. And then you are going to stand in front of the patient. Tell them to open up. And then pull their cheek back. You're going to slide it in there. And then you can help them hold it down. Another thing is that you want to have room temperature water. Cold water makes the setting time longer. Hot water makes the setting time shorter. So then when you are taking out the material, you want to lift it, you want to hold it, and you want to lift, and then you want to ease your way out, and then you want to make sure you have all your teeth. There's no tray. And then you're going to go to the maxillary, sorry. So the maxillary is 3 to 3. So what we're gonna do is just gonna go like that. And then cap that. And then we're just gonna mix for another 30 to 45 seconds. Halfway through, you want to wipe off your spatula. And then for the maxillary, you want to put majority of the alginate towards the anterior portion of the teeth, because when they put it in their mouth, you don't want it sliding down the back of their throat. You want it to come out the top. Okay, so then I pour my material in there, and then I am going to do the same thing. So he's going to open up. I'm gonna tilt that in there. Make sure it goes all the way back. Help him bite down on that, and I can help him hold it. If this were a real tray, it would have holes in it, and that's like the locking system for the alginate, so that the tray doesn't just slide out. Once your 2 minutes is up, you are going to hold on to it, and you're gonna pull out, and then you're gonna ease your way out. And then what you do with your maxillary and mandibular is you would go rinse them into water so you get all the bacteria. And then what I would do is I'm sorry, the maxillary, you're supposed to be standing behind the patient, and then you're supposed to load it like that. Then to store them, you would take your baggie and write the patient's name on it. You would wrap it up in a moist paper towel, and then I would clean this. That I can wipe down. This I can wipe down. This I can wipe down. My station I can wipe down. Anything I touch, I use, I can wipe down. My instruments, like my mouth mirror, can be sterilized. And so then, what I would do is take off my stuff. I take my baggie with my patient in there and wrap it inside out. I go and pick up my compression, flip the baggie inside out, and then I would spray down with calisone. Close it up. Close it up, and then I would be good to go.